Hi, I'm Dr. Richard Hongo, and I'm a cardiac electrophysiologist. Today we're here at California Pacific Medical Center, which is in San Francisco. This is one of our dedicated electrophysiology labs where we're very fortunate to have cutting-edge technology that allows us to perform complex catheter ablation procedures such as ventricular tachycardia ablation. Now, as you may know, cardiac electrophysiology is a subspecialty of cardiology that deals with all different types of heart rhythm problems. Ventricular tachycardia is one of those problems, and it is very important primarily because it can be life-threatening. Now, there are many therapies out there for ventricular tachycardia. Some of them include medications that suppress the heart rhythm problem. Others include implantable devices such as defibrillators, which then monitor and at times need to shock patients out of the rhythm into sinus rhythm or normal rhythm. Ventricular tachycardia catheter ablation is a very important tool in the management of this rhythm problem because it allows us to actually find the problem and eliminate the focus that is causing the rhythm disturbance, and many times really help in controlling someone's rhythm alongside things like the medications or the implantable devices. Today, in this video, I would like to explain how catheter ablation is used to treat ventricular tachycardia. Let me explain by looking at the normal heart rhythm for a minute. When you think about the heart is essentially a pump. It's a pump that circulates the blood through the rest of the body. But if you take a closer look at the way the heart is made up, you can notice that there are multiple chambers within the heart. The top two chambers are the atria. The bottom two chambers are the ventricle. And the way the electrical activity actually organizes the contraction of the heart is through a very complex electrical wiring system. The activation starts in the top of the heart, up here in the sinus node, and it travels through the electrical system from top to bottom. And you can see the yellow colored electrical system here on this diagram. Another very important function of the electrical system, other than synchronizing or coordinating the heart, is making sure the heart doesn't go too fast. And that's primarily done through this portion of the heart called the AV node. This keeps the rhythm from never going so fast that the heart would degenerate. Tachy means fast. Ventricular tachycardia is essentially a fast heart rhythm or tachycardia that occurs from the ventricles, the lower chambers down here. And the reason why this rhythm is so concerning is because the rhythm happens outside of the normal electrical wiring system. So it is no longer regulated, the rhythm can degenerate, and it can go so fast that it actually can become what we call a cardiac arrest. And this, as you may know, is a life-threatening condition. The ventricular tachycardia a lot of times happens from a spot or focus within the lower chamber that essentially starts to act up and starts to run off on its own. Another reason for developing ventricular tachycardia is electrical activity can get stuck in a loop, and it goes around in a short circuit, usually involving areas that are scarred within the ventricle. Ventricular tachycardia ablation is all about finding the spot or the short circuit that is causing the rhythm disturbance, and using catheter-based technology we find and eliminate the cause. Here at California Pacific Medical Center, we have our anesthesiologists sedate our patients very comfortably at the onset of the procedure. And through a small incision that I make at the groin site, I place sheaths into the veins, and you can see me putting in catheters here. Then we push soft insulated wires or catheters through the large central veins, and you can see the catheters now floating up through the inferior vena cava. And we can also utilize the stereotaxis remote navigation system to move catheters inside of the heart. There are several advantages of using this newer system. One of them is the catheters are very soft. You can see me pushing the catheter now up against my hand, and it buckles very easily. This virtually eliminates the risk of catheters causing any unwanted injury to the heart wall. Also, in addition to this, using these large earth magnets that are housed in these retractable towers. And in this image you can see the towers being pulled in on either side of the patient. The magnets then move the magnetized catheter with millimeter precision to really all corners of the heart just through computerized controls. And you can see us now dragging the arrow icon on the screen and moving the catheter in this way. In a very controlled environment, we start up and stop the ventricular tachycardia using pacing and intravenous medications, and we start visualizing where the tachycardia is actually coming from. Here is a reconstructed 3D virtual image of the inside of the right ventricle in a patient with ventricular tachycardia. The earliest electrical activation is seen here on this map and shown by red. So let me explain catheter ablation in a little more detail. If this here, my hand, is the wall of the heart, the ablation itself is caused when the tissue underneath the tip of the platinum catheter electrode is heated to somewhere between 50 to 60 degrees Celsius. Now this in and of itself is not very hot, but when kept on one spot long enough, somewhere between 30 to 60 seconds at a time, that's enough to cause some denaturing right below the tip of the catheter itself. And this denatured tissue stops all electrical conduction. And over a few months' time, this denatured tissue then heals itself into some permanent scar. And this is what keeps ventricular tachycardia from reoccurring. So in summary, catheter ablation for the treatment of ventricular tachycardia is a procedure that really relies on us being able to precisely localize where the site of tachycardia is actually coming from. It is through real advances in technology that we've been able to now perform this procedure not only effectively, but safely, such as the use of 3D imaging, where we're able to visualize where that spot is actually coming from, or the use of magnetic remote navigation, where we're able to move catheters safely as well as precisely within the ventricle. Catheter ablation is an emerging tool in the treatment of ventricular tachycardia, and alongside other therapies such as medications or implantable cardioverter defibrillators, it should be a treatment that is considered anytime you're dealing with ventricular tachycardia. I'm Dr. Richard Hongo, and now you know.